Thank you so much, Madam Speaker, and I will be sharing my time today with the member from Brandon Souris. Madam Speaker, 5 minutes to talk about mental health is certainly not enough time, and I appreciate the grace that has been shared tonight and vulnerability, and I also appreciate that every single member in this House has been touched by mental health. I appreciate that everyone acknowledges that this is a crisis, but my frustration and anger is at a bubbling point, just like many Canadians around this country. We do not need more advocacy, we need leadership. Madam Speaker, this week, 31-year-old Burnaby RCMP officer, member of the detachment's mental health and homeless outreach team. Just 3 years into her career, Constable Shaylin Yang was fatally stabbed while attending a homeless campsite before 11 a.m. in broad daylight. And I want to tell you what our Prime Minister said, and this is a quote from him yesterday in question period. We need to do more to step up on our mental health funding, as the honourable member mentioned before. And he was referring to our honourable member from Caribou Prince George, who has been an advocate and great work tonight to my colleague. He went on to say, we need to make sure that we are giving our frontline police officers the tools to be supported as they encounter difficult situations. We need to make sure they are not the only mental health workers out there accessible to so many people. Unfortunately, they have been. They have been extraordinary at it, but we need to provide better support. The provinces and the federal government need to work together to fund more mental health support. That is Prime Minister Justin Trudeau. Madam Speaker, I apologize.
I cannot use names, and so I just want to remind individuals to please respect the rules of the House. The honourable member for Peterborough-Karratha.
It cannot use names. I appreciate that. My frustration lies that if the Prime Minister is not able to do more, then who is? Who is able to do more if at the highest level of our federal government we cannot do more? There are two things a leader needs to do: listen and act. And there has been countless people come before here, committees, years, decades and decades and decades of people telling us, parliamentarians, what is wrong. So why aren't we listening and why aren't we acting? We need leadership. I want to focus on the UNICEF Report Card 2020 release, Madam Speaker. And this is a quote from their report card. Canada is worlds apart from other rich countries in providing healthy, happy childhoods for every child. Canada ranks among the countries with the best economy, the best environment, and best social conditions for growing up. But it is the poorest in outcomes for children and youth. Canada falls below average for more than half of the measures of child well-being. Canada ranks lowest in child survival, ranking 35 out of 38 in teen suicide and 33 out of 38 in child violence, including homicide. The UNICEF report card rates Canada as not making progress relative to other rich countries. Canada has been making little to no progress in reducing child mortality, obesity, and bullying. Canada has been falling backwards in children's sense of well-being and the quality of their close relationships. Canada is one of a handful of countries that have better economic environment and social conditions, but worse child well-being. Canada's government spends less on families and children than most wealthy countries. Madam Speaker, if this doesn't disgust this House, I don't know what should. If we do not take care of our children, we do not have a future. And how can our children be taken care of when the adults aren't taken care of? We've made so much strides in overcoming stigma. People are ready to go ask for help, but when they do, there is nothing there for them. I'm sorry. I adore the work my colleague has done on this file. He is so passionate about mental health, like so many people in this House are. But when our lead is mental health is health, that is 20 years behind where we should be. We know mental health is health. Why aren't we transferring the $4.5 billion promised by this federal government to make a difference? The Canadian Alliance on Mental Illness and Mental Health recommendations. Listen and act. That is leadership. So listen to what they are asking. Take immediate steps to create a mental health transfer, allocating permanent, ongoing federal funding for mental health services starting in Budget 2023. This is consistent with the multi-year funding promised in your 2021 election platform. Madam Speaker, people are dying. What more is needed? I see my time is running out. There is action we can take today And I call on this government and everyone in this House. This is nonpartisan. This impacts every one of us. Make the difference today. We need leadership, we need to listen, and we need to act. Thank you, Madam Speaker.
Questions and comments?